If you've been told that you need supplements, hormones, or expensive tests just to feel like yourself again, I want you to stop. Most of the women I see in their 30s or 40s are feeling tired, flat, exhausted, or maybe just not quite right. And they assume the answer is their hormones. But before you succumb to HRT or a stack of expensive supplements, there are a few basics that you need to get right first. I'm Nina, I'm a doctor with an interest in longevity medicine and women's health, and here I'm sharing hacks, tips and frameworks to help you feel better, as well as my journey through my 40s to making this the best decade yet. So hit subscribe to follow along and let's get to it. We seem to have created this culture, especially with social media, where normal physiological responses to poor nutrition, poor sleep, lack of exercise are attributed to hormones or something that can be fixed with yet another supplement or yet another device, usually an expensive one. But the thing is, in order to feel your best self, you have to focus on the basics. And when the foundations aren't there, no amount of hormone therapy, HRT, or expensive supplements are going to help you. The first thing I wish everyone could master is the thing that is probably the most difficult to fix for people. But once you get a specific toolkit that works for you, it can be transformational. It's also the thing that I see probably the most frequently in clinics, the thing that has the biggest impact on other illnesses and on your just general well-being and how you're feeling about yourself. It's also something that people often don't think about as having an impact because of the way our society is now. It almost becomes a badge of honor. This thing is sleep. I see probably one patient a day who complains about sleep and is requesting medication to help them with sleep. And the thing I often tell them is that the medication that we have available at the moment don't really give you restful sleep. They are sometimes what we call hypnotics or sedatives, and they don't allow your brain to go through the natural phases of sleep so that you wake up rested, so that your brain has managed to clear out all of the toxins and the waste products that build up throughout the day. They just give you the illusion of sleep, and that's not what we're looking for. If you can fix your sleep, everything from your mental health to your physical health will be better. I actually remember a patient who came to me who thought he had dementia, and he'd seen a number of doctors beforehand, and it was probably his 5th or 6th visit. He had had a brain scan as part of the workup for dementia. His brain scan was normal, his blood tests were all normal, everything was normal. Except that he was complaining of a poor memory, of forgetting things frequently, of just generally feeling like he wasn't himself. So we went back to basics. I asked him, how many hours are you sleeping? When you wake up in the morning, do you feel rested? And guess what? He was sleeping 3 to 4 hours a night. He was a very high-flying businessman. He was staying up late at night to do work. He was then waking up at 5 a.m. because this is what people told him he should do if he was successful. And he wanted to, seize that day, eat that worm, get up at 5 a.m., go for a run, get everything packed in. That's fine if you're going to bed at 8 or 9 o'clock. But if you're going to bed at 1 o'clock in the morning and then you're waking up at 5 a.m., well, that's 4 hours of sleep. That is not enough. And over a long period of time, that will mimic things like memory problems. You will get poorer health. You will just feel rubbish. We went through some strategies to fix his sleep, and I reviewed him a few months later, and guess what? His memory problems were fixed. He was like a new person. It is not a badge of honor to sleep 5 to 6 hours a night or less. I do think this is changing. There is a conversation that was initiated by Mathew with his book, Why We Sleep, which, by the way, changed my life. We know now that poor sleep will affect everything, essentially. And if you are not sleeping properly, if you're not waking up in the morning feeling rested, this is the first thing I urge you to try and fix. A few evidence-backed non-negotiables that are part of my sleep routine and often the first things that I recommend to my patients. Morning sunlight. So if you have a coffee or whatever you do in the morning, just get outside. If it's a sunny day, 5-10 minutes. If it's longer, a bit longer might be needed. It's not always easy. What I used to do driving to work was wind my window down in the car when we stopped at traffic lights and just let that air, let that sunlight go into my eyes, look up into the sky, look into the clouds, not directly at the sun, obviously. And in this way, you're helping to set your circadian rhythm for the day. If you can add on an afternoon walk, so you get the late afternoon, evening sunshine as well, that's great. But the morning sunlight is the thing that's really going to impact you because it will help to regulate your hormones and to make you sleepy towards the end of the day. And I think that's what people struggle with the most, is actually falling asleep. If you can incorporate some movement into your morning sunlight, like a gentle walk or a run, then bonus points. The other thing is having a predictable wind down routine and a set time to go to bed. If you're going to bed at 8 o'clock one night, midnight the next night, 10 o'clock the next night, your body's not going to know where it's going or what time are we going to sleep. So trying to have a predictable routine. So going to bed at 10 p.m. and waking up at 6 a.m., 7 a.m., but try to make it within that half an hour to an hour, and that will really help you. If you can't do this because of your shift work or you have children or you have commitments, the other thing you can do is having a predictable wind down routine. So for me, it's washing my face, brushing my teeth, going through that skincare routine. I tend to read for half an hour. Sometimes I might do some light stretching. Try to avoid blue light. I think everyone knows that by now. If you can have your phone outside of the room, great. But these are all extra things that you can add on. So start with the basics. Start with morning sunlight, plus or minus exercise if you can, and a predictable wind down routine and a set times for going to bed and waking up. That alone will have a big impact on your sleep. I feel like I can hardly open social media nowadays without someone telling me about their new supplement or the amount of creatine they're taking, the functional mushrooms they add to their coffee. And all of these things are great add-ons, don't get me wrong. I take a lot of these things. But what is often missing is the foundation of nutrition. It should always be food first principles. People often forget what comes before the supplements, what comes before the functional mushrooms, what comes before these add-on nutritional supplements, essentially, and that is food. Regular meals matter. Most women don't come to me eating poorly. They come to me having not eaten enough for a long period of time. They've been skipping meals, they've been surviving on morning coffee and not having breakfast. Before you start adding to that with more supplements that are trying to replace things, it's important that we see them as an addition rather than a replacement. Essentially, your body needs fuel. It needs food as fuel. Yes, you can add in protein to your morning coffee if you're not getting enough protein in your diet, but you also need to focus on where you're getting the protein from, where you're getting your fatty acids. I do take an omega-3 supplement and I do think they are good, but the evidence suggests that they're not as effective as getting the fatty acids from food like salmon, like sardines, like flaxseed if you don't eat fish. Regular meals matter. And protein matters, and where you get these things from matters. You can't just replace a pill and then carry on eating poorly and without thought. You need to be intentional about it. Supplements are just that. They're supplemental. They're not replacements for food and diet. And like how we skipped food in our early 20s, maybe early 30s, get away with skipping the exercise. I used to just run and do loads of cardio. Never really thought about strength training, but as I'm getting older, I'm noticing that I need to do strength training. I need to build muscle mass because that's what's declining. That's going to support my bones, it's going to help me sleep better, it's going to help my metabolism, and of course your metabolism in turn will impact your weight and your body composition. And then there's all the things that we don't see, like insulin sensitivity and self-confidence. And then alongside strength training, the other thing I want to add is balance and mobility training, which I think sometimes is neglected because it's all very well being really strong, but as we get older, the proprioception, which is the way our body tells where we are in space and whether or not we're going to fall or stumble, those things also decline. So you need to train them. You need to practice balancing, whether that's with yoga or Pilates, or whatever you want to do, maybe just standing on one leg in the shower, moving your head around to test the balance organs in your head and your limbs. You can train this just the way you can train your bicep to become stronger. And that, as you get older, is going to help you to prevent falls. It's going to make you more stable. You'll feel more confident. You'll be less prone to injury because you won't fall. And it's just one part of the longevity puzzle. So to put it all together and to wrap it up, get the basics, the foundations right. Be intentional about everything. Intentionality is one of the most important things we can do. Don't just take another supplement because an influencer told you to. Don't just add in weight training because an influencer told you to. Think about what you need and what's important or lacking in your life. Strength training plus walking is better than endless HIIT training. A balanced diet incorporating all of the things that you need is better than blindly adding protein. So essentially, the uncomfortable truth is that no blood test is going to tell you which lifestyle factors are making it feel like you can't keep up with your lifestyle or the lifestyle that you want to have. No hormone is going to compensate for overeating and under-exercising. No supplement is going to override chronic sleep deprivation. If you get the foundations right, you don't even need anything else. You will feel better. It sounds easy. Actually putting things into practice is the hard part. We can go into this in a bit more detail. If you'd like me to cover anything else, let me know below. And if this resonated with you or brought up any questions, I'll be going deeper into this and other topics in future videos, so be sure to subscribe.